Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Golnur Sharif Saleh, providing you with information on aging-related topics. Learn more at geriacademy.com and follow me on social media.
Welcome to the Geri Academy podcast with your host, Dr. Golnur Sharif Saleh. This is episode 11. Hello, everyone, and welcome to this episode. I took a few weeks off because I've been wondering if the podcast has been effective or if I'm accomplishing the goal that I set out to accomplish. Initially, I created Geri Academy so that I could provide education to my patients. Not only do I love to treat my patients in the office, but I also want them to understand aging related disease processes because I think it's so important that patients understand and have all the information before they make any health related decisions. One of the problems that I noticed was I couldn't really refer my patients to good information on the internet. The information is either really long to read, difficult to understand, and so the goal of Geri Academy was really to have blog posts, maybe 3 to 5 minutes maximum, with just bullet points, information that my patients could comprehend and digest, and their loved ones, of course, like children of my patients as well. And I've had a lot of fun recording this podcast with my fellows and some of my guest speakers, but I wasn't sure if it's exactly what I needed it to be because maybe it does need to be short like the blog posts. I would really appreciate any suggestions from listeners. I've looked at the analytics and I really appreciate you listening to the podcast from all over the world. I was pleasantly surprised. But if there are any topics that need to be covered, or if you want me to take a different direction, I am happy to do so because I really just want to provide information. The other thing with Geri Academy is I did not want it to be related to any particular practice or healthcare system because I did not want that to be a barrier. I want everyone to have this information, and the information is coming from me. I have been in medical education and I have been treating patients now in the past or for the past 10 years. And I've trained geriatricians. I'm proud of that work. I have done research. I'm proud of that work. And recently just opened a brand new practice with my beautiful partner, Kate Marshall, in Asheville, North Carolina. Just the mountains are beautiful. So now the post, I guess I should get to this post so that it doesn't get very long. But today's episode is on dementia. I started a dementia blog series, and this episode I wanted to cover, again, bullet points. I wanted to get to the point, but could this be dementia is what it is titled. And as a geriatrician who specializes in memory disease, I see patients almost daily for memory related issues. So sometimes my patients come to me because they have concerns that they're developing dementia, or sometimes family members bring them to the office because they have noticed signs and symptoms that their loved one may have a memory disorder. And so, what I really wanted to do is talk about the differences between normal changes with aging and abnormal signs of memory loss so that you can maybe recognize some of the abnormal signs and recognize when you or a loved one may need to seek help from a medical professional. So, normal changes that occur as we age, dementia is not a normal part of aging. It is a disease process that needs routine follow up and management. It's essential, though, to recognize the normal aging process from dementia to know when you need to get help. And as we age, some of the expected changes that we experience include forgetting appointments or names, but then later remembering them. We occasionally may forget we left an object in a room. Like I walk into a room and can't remember, why did I walk in here? And then we realize what we forgot. And we may have more difficulty multitasking. We may have more difficulty and it may take us longer to retain new information, but we still have the ability to retain and learn new information. We may react slower to a situation or get more frustrated when something is out of our routine, and that just has to do with what our brain is used to. And the point is that these are normal changes, and we are still able to retain, learn new information, and really function and perform our normal day to day task with no disruption. And so, what changes in memory are not normal, not a normal part of aging, and maybe need to have some attention? So, when memory changes start to interfere with day to day function, this may be due to a memory disease and require professional medical evaluation. Some signs of memory loss that should signal alarm include losing the ability to learn new information, having difficulty with dates and time, forgetting recent events. But again, not being able to recall those recent events, even if you forget them. So a person may completely forget a new appointment, even if they're reminded of the event multiple times, or they may ask the same question repeatedly. A person may start to ask loved ones for assistance with tasks that they could manage independently in the past, like paying their bills or shopping for them. Or a person may start to get lost when they are going to a grocery store or going the same places that they used to go. So, problem solving and planning out tasks become difficult for people who have memory diseases. Like I just said, familiar tasks are more challenging, right? Using a phone, a television remote control, a stove, a microwave, organizing a grocery list, and getting lost. A person may misplace an object and they may be unable to retrace their steps to find that object. A sign of memory disease can also include changes in mood or behavior. So, for example, a person may experience paranoia. They may start accusing loved ones of taking their belongings, or a person may start saying inappropriate things, which were not kind of their norm in the past. They may start cussing, and a spouse or a child might say, dad or mom never used to use these words before. This is completely out of their norm. Or they may become angry and have no filter. Sometimes a person may even start to withdraw and appear to feel overwhelmed in social situations. And sometimes, one of the other things I've noticed is children will come in or spouse will come in and say, Mom can't prepare a meal anymore. She has difficulty following recipes. And another common sign of abnormal aging is having problems processing information about three-dimensional objects. So, making it particularly difficult to use the stairs, parking a car, recognizing objects in space. And sometimes a person may interpret something as something else. So, for example, mistaking a driver's license for a credit card or mistaking a television remote for a phone. A person with a memory disorder can make poor decisions and develop poor safety awareness. This is really important when I see patients who have mild dementia, and it's because they are at risk for exploitation. Someone may manipulate them to give all of their money away, for example. And I have seen this with my own patients. So, a tidy and organized person may no longer pay attention to keeping their home organized, or they may start hoarding. Those are some other signs of abnormal aging processes that could indicate there could be a memory disorder. A person may stop paying attention to their grooming, wear the same unwashed clothes daily, or they may wear inappropriate clothing for the season. And so, if you notice that you're forgetting things and you're not remembering them, or if you're noticing that a loved one is unable to function in their day-to-day tasks, then, I think it's important to seek help. And the best place to usually start is with your healthcare provider, their primary care provider. They have been trained to do some things and perform some standardized testing to really evaluate if there might be a memory disease. And, you know, I don't particularly call everything Alzheimer's disease, and in the future blog post and that you'll see and in a future podcast, I'll really talk about different types of dementias. Dementia, the word dementia is not Alzheimer's disease. Alzheimer's disease is just a type of dementia. And so I will elaborate on that more. Again, what I was hoping to achieve in this podcast was a quick understanding of just what is normal and abnormal when it comes to the aging process and possible dementia diagnosis. So, geriatricians are particularly good at evaluating and treating patients for memory problems. Assessing patients for memory issues is just a part of our training. Most of us have had this training. We go to medical school, then we go through our residency program. Usually we have a family medicine residency or an internal medicine residency program. And then after that, we are trained in 1 or 2 years of a geriatric fellowship. And in that geriatric fellowship, we really learn how to look at memory disorders and we learn other awesome things. But neurologists are also trained to see patients for memory problems. Cognitive psychologists can also evaluate patients for memory problems. And so if a person starts to have some abnormal signs of aging and they tend to be a little bit younger, they usually are seen by neurologists and cognitive psychologists after their evaluation by their primary care doctor. Other times, when a geriatrician sees a patient in a memory clinic, that usually is a long evaluation. And as geriatricians, we provide a lot of education and we sort of step back and look at the big picture. And we also talk about progression of disease, the diagnosis, and usually our evaluations tend to be over an hour long just because we really want to make sure that our patients and their loved ones truly understand the diagnosis and all of their questions are answered. I hope this podcast episode was helpful. Again, my goal is to make these short and to get to the point because I don't want my listeners to get bored, but I really need you to get the information that will benefit you. If you want me to go back to the other way and longer podcast episodes, I'm happy to do that. And I'll probably blend some of these. But right now, I'm in this dementia series, and dementia is really a disease that I am passionate about treating because it does affect the whole family. And it is at this time devastating because we don't have a cure for it. So please respond and send me your comments. I would love to um, message you back. And if you're in the Asheville area and you're in need of a primary care provider, you can always look me up. But there are many wonderful providers out there that can evaluate you for any memory disorder. Thank you, and I will talk to you soon.
Thank you for listening to this episode of the Geri Academy podcast. Learn more at geriacademy.com or follow me on social media for information on future episodes.